Good morning, everyone. Thank you for coming and welcome. I'm going to get us kicked off for the morning. My name is Damon Phelps. First name. And get us through another great and helpful educational morning too. Just a little bit of a context. So many of you have been with us since the beginning. Some of you are new. This history goes back for us at CBS 6 years. So to 2016, the last year of the Obama administration, when things were happening there too, we were also starting to get involved here as well. And that helped us get things launched off. Culminated in what is now called REAP, which is the reentry acceleration program, sorry. So that's where we went from that in 2016 to 2017, having a business forum, which took the form of several breakfast meetings. Again, a few of you were there, and where some of us met for the first time. And that was one where we had CBOs and employers, educators, all coming together and talking about employment for system impact at folks. And it was something where we learned a lot, and was a rare opportunity for folks across the boroughs and really tri-state to actually sit and learn from one another. And a lot of things came out of that. One of the things that came out of that was a need to really think about employment by sector. So we began sort of thinking about it generally, but the issues from one sector to another really, really vary. So we wanted to focus on things by sector. And so one of the things that came out of those initial business forums was, okay, we should focus on sector. The other thing is that we wanted to create, or at least be a part of, convening folks in a smaller, more intimate setting. Because a lot of the discussions, especially now when you start to think about it by sector, are more specific kinds of things. You also have employers who may be quite interested in hiring from this population, but not yet able to be public about it, or not public about it. And so we wanted to create a space for that. And the sector that we began with is healthcare and hospitals. And so that's what led to a set of meetings that we had. And through that, we learned quite a bit. For those of you, again, may remember, we had several speakers. We had Yariella Cardonovan from Johns Hopkins Medical. They've been doing work in this area for I guess we can say decades now, and really have thought a lot about this, and can talk about how not only sort of what they do internally, but how it's facilitated through working with CBOs. So that was great. We also had Eric Eingold from Youth Represent, who he went through sort of what is a rap sheet. And so a lot of people, even people who have criminal records, don't really know what it is all the time, how the errors that can be there sort of. And so, but as an employer, if you're trying to read something and trying to understand what's going on, it's really helpful to have that particular perspective about what goes into that and what it means, and the errors that can be embedded in that. So it was a very very generative time that we had. And like most things, the pandemic sort of shifts everything. So we held off on the meetings, and now coming out of it, I mean, this, pause to say sort of out of it, because I'm not sure what out of it means. But as the journey continues, One of the things that the world has also changed, of course, so employment needs in healthcare have changed, but we're overall as a country dealing with a tightening of the labor market. So there are a lot of factors that are at play, and as well as a growing recognition and comfort with a level with talking about hiring from populations that previously were maybe stigmatized or marginalized. And so justice involved folks is something which is now a more of a topic that people have discussed more openly than in the past, which is great. And so we're very excited about the progress that we've made. The shift in caused by the pandemic has also led to a shift in the way that we're also thinking about how we can be helpful. So as a university, it's generally sort of two things that we sort of think about. So one is that we educate and we do research. So we generate knowledge that would be helpful around a particular topic, and this employment topic is one. The other is as a convener. So as a university, it's easier for us to sort of bring parties together around different things. And now with, even when didn't have beautiful facilities overlooking the Hudson, that was true. And now we have this a beautiful facility to match. And so we're excited about always playing that kind of role as well. So I'm going to turn it over to Ivy, who's going to be the moderator for the first panel. So thank you. And again, welcome to everyone.
All right, well, for those of you who don't know me, my name is Ivy Hatzengate. I'm director at the Tamer Center for Social Enterprise, and I lead our reentry acceleration employment efforts. I just wanted to reiterate Damon's welcome. It's really wonderful to see all of you in the room. Some of you I've seen, pre-pandemic, and also to be joined by those of you online as well. For our first panel today, Healthcare Perspectives on Hiring, I'm thrilled to be joined by Tonya Richards from Columbia University Irving Medical Center and by Curtis Dann-Messier from New York City's Health and Hospitals Corporation. So I'd like to first start with a little bit about their impressive backgrounds. So Curtis Dann-Messier is the director of the Health and Hospitals Peer Academy, which trains individuals with lived experience with mental health or substance use challenges to work as peer counselors in the public health hospital system. Previously, Curtis was the university director for workforce programs at the CUNY Central Office, where he oversaw paid internship programs for 1,000 students a year and directed a 120-unit housing program for formerly homeless veterans. Curtis has also worked as the director of the New York City Peer and Community Health Worker Workforce Consortium at the New York City Department of Health and Mental Hygiene, where he started the New York City Justice Peer Initiative. A Justice Peer is an individual who uses their lived experience with the criminal legal system to support others who are also ensnared in that system. Curtis is one of New York City's leading experts on behavioral health workforce at the sub-baccalaureate level. Prior to his career in workforce, Curtis was a classroom teacher. He holds a bachelor's degree from the University of Wisconsin-Madison and a master's degree from Hunter College. Now, Tonya, we could do silent clap. For all of that expertise in the room. Tonya Richards is the inaugural Chief Diversity, Equity, and Inclusion Officer for staff at Columbia University Irving Medical Center and the Executive Director for Human Resources and Academic Affairs at Columbia Doctors. In these dual roles, she's responsible for providing strategic human resources support and DEI leadership to all stakeholders. As the CDEIO, she develops and steers diversity and inclusion programs, consults on the recruitment and development of a diverse talent pipeline, and fosters a culture of equity throughout the medical center. This role ensures that CUIMC is building a supportive environment to meet the needs of a talented workforce and fosters an organizational organizational culture that is responsive to the dynamic needs of staff and the diverse communities that they serve. Tonya started her career in healthcare HR over 18 years ago, couldn't tell. She graduated from Cornell University with a bachelor's degree in industrial and labor relations and received a master's degree in human resources management and development from New York University. Tonya holds several human resources certifications and credentials, including the Society of Human Resources Management Certified Professional, Professional of Human Resources, Certified Healthcare Human Resources Professional, Certified Diversity Professional, and last but not least, she is a Certified Executive and Career Coach. Please join me in welcoming Tonya and Curtis to the panel. So now that we've heard a little bit about your backgrounds, I'd like to start by having each of you introduce your organizations. And we're going to have Tonya go first, and I think Diana is going to help with the slides. Oh, I think she has it. Or do you need me to do it over here? Oh, okay. You want to just come up to the podium?
Oh, sure.
Or it's up to you, however you'd like to do it.
Thank you all for having me. Thank you, Ivy, for that wonderful introduction. So I wanted to take an opportunity to share with you a little bit with regards to Columbia University Irving Medical Center and just provide some background about our institution. I was joking earlier about the fact that even though we're affiliated with Columbia University, the medical center sort of on its own, uptown, as we refer to it, and this is downtown, but it's a very dynamic institution, and we do employ a lot of individuals there, both faculty and staff. So with regards to Columbia University Irving Medical Center, it is a clinical research, community service, and educational enterprise located on a campus in Washington Heights. We currently employ almost 10,000 individuals, and we do have a number of staff there as well. About CUIMC, as we like to refer to it as with regards to the acronym, we do have 4 schools at the medical center. The first school is the Vagelos College of Physicians and Surgeons. The second is the School of Nursing. The third is Millman School of Public Health, and the third one is the College of Dental Medicine. And some of you may know, but we are also affiliated with New York Presbyterian Hospital. We also work closely with Weill Cornell Medical Center, and we are also affiliated with New York State Psychiatric Institute. So as far as our pipeline programs, one of the things that we'll delve a little bit deeper into, but I wanted to share here, is that we do have some pipeline partners that we've fostered relationships with within the last 2 years or so. And some of them are most of them are listed here. The first one is Grace Institute, Strive, as I'm sure most of you are familiar with and you'll hear from later today. FIPS New York, the Consortium for Customized Employment, or Job Path, and you'll hear more about that later today as well. And finally, Grants Associates is one of the partners that we currently have with regards to creating a pipeline program. As you could imagine, during these times, it's very challenging to attract and retain employees. So we're really trying to ensure that we are exercising different strategies so that we can win the war for talent. And I just also wanted to share here, I'm not quite sure if the deck is going to be shared, but this is our website when you're looking for where you can see opportunities for the medical center. And one of the things that we try to do, especially when it comes to working with our pipeline partners, is that if someone is coming to us via those particular programs, we ask that they specifically reach out to us and indicate that so that those applications may get priority viewing. And I'll pause there because I know you do have some questions later.
So I'm actually gonna have you leave that, and then you come down, you go up to the podium, and I'm gonna have you share that microphone. Thank you, Tonya. The joys of running a hybrid event. So we have people in the audience online. Later, we'll have panelists online as well.
Sorry, I just have to share the screen with Zoom real quick. There you go. You're all set.
Thank you. Thank you, everybody. So I'm going to talk a little bit about New York City Health and Hospitals, just really quick. New York City Health and Hospitals, for those of you who don't know, it's the largest public healthcare system in the United States, largest public hospital system, serving more than 1 million New Yorkers every year in more than 70 locations across the city, the flagship being the 11 acute care hospitals. We have our own health plan, Metro Plus, which covers 500,000 New Yorkers. And, you know, the really big is the bottom line number. It's one of the largest employers in all of New York City. New York City Health and Hospitals has over 44,000 workers. Next. You know, I just wanted to comment, I'm in behavioral health at New York City Health and Hospitals in the central office, specifically working with peers, which we talked about in the my bio. Individuals who have a lived experience with mental health and substance use challenges are now in recovery and use that experience to help others. So there's a huge demand for peer workers. It's very relevant to the reentry population, many of whom who might be in the criminal legal system because of mental health or substance use challenges. So there's a huge need for peer support workers and really any behavioral health title. There's a huge need across the US. So there's a lot of our work in the central office at Health and Hospitals is really try to help fill these behavioral health positions. And this is a peer support worker, which I'll talk a little bit about. This is an in-demand middle skill occupation, which means you need an industry recognized credential, but not a college degree. And peer support workers, while really established first and foremost in mental health and substance use settings, we're now starting to grow that for, you know, peers working in housing who have lived experience with homelessness, peers working in the justice setting who have lived experience with the criminal legal system. And it's a way to use that experience to help others. There's also youth peers, family peers, and others. Here is, I don't know if this will be sent around, that's my email. If you know individuals in your organization interested in a training program to become peer counselors in the public hospital system, you can give me, send me an email. We're recruiting right now for our fall cohort. Or you can scan that QR code or, and we'll make sure you get an application for individuals who would like to work as peer counselors in the public hospital system.
Thank you. So I'm going to have the two of you share that, and I will use this microphone. Perfect. Well, thank you both for sharing a little bit about yourselves and your organizations. Let's start with the $1 million question. So why are you interested in hiring people with past criminal records? And then there's a two-part follow-on, which is how does this make sense for your business? And what concerns, if any, do you have?
You want to start?
Oh, sure. Thanks, Tonya. I'll say that, you know, we as peer counselors, we're, you know, our population is individuals who have a lived experience with mental health and substance use challenges, and the overlap is obviously very great. The Venn diagram between those who have a criminal legal system history and mental health and substance use challenges in this country, unfortunately, is very great because we have used the criminal legal system as the place where someone with mental health or substance use challenges goes because there's no other place for them in the society. So when we're recruiting this population, we know, unfortunately, one of the biggest places to look is for those who have a criminal legal system history. And besides that, we also know that the individuals in the criminal legal system history really have a way to help our patients and those that we serve to, learn from those experiences, provide their insight about how to stay out of the criminal legal system as best that they can. So really having that experience is very important when trying to connect with individuals who have a shared history or, a desire to stay out of the system. The second part was the difficulties. Was that kind of
Any concerns that you might have?
It can be a concern at a healthcare institution to pass the background checks. We have done a lot of work to make sure that we do everything possible at the public health system to help people get through that. But there are the Justice Center that we have to report to. It's not our decision of who gets through that, as well as the state central registry. And those can be, onerous and not necessarily easy barriers to overcome for this population. So that's always a concern. And, it's really sometimes sad to see people who have really worked so hard and would be terrific peer counselors not be given an opportunity to work because of things that they've done in the past, especially with regards to sex offense at any point, and then a violent offense in the past 10 years. And then the state central registry might even have ACS cases or other little things that are administrative burdens that in total really make it difficult to bring people that we would love to bring on board.
Thank you, Curtis. As far as CUIMC, I think hiring people with past criminal records, that's important to us, especially from a diversity, equity, and inclusion perspective. We are really committed to ensure that we have a diverse population at the medical center in particular roles. And this particular population, as we all know, I'm sure it's not a secret that unfortunately, the population of people that have been imprisoned are a majority minority, or those who have been historically racially marginalized. So that's a pool that we would like to tap into, because as Curtis indicated, it is a large pool. A lot of us currently are challenged when it comes to recruitment and retention. We also find that even though we do not have a formal program currently at the medical center, we have had persons that we've hired with criminal history background that we have employed and put through our fair chance process. And we found that those particular individuals have been very dependable, and we were able to retain those particular employees. So we would like to ensure that we have a formal program to do that. With regards to any concerns, I would also share what Curtis indicated, and that's with regards to the time that it may take, with regards to processing, because we want to ensure that the decisions are not being made just based on the person's criminal history, and that decision is made based on the person's qualifications for a particular role. One of the things that we're finding currently, and I'll try to wrap it up, is that the process to onboard someone, especially if they have a criminal background, does take a little bit longer. And it's something that we're finding is delaying the onboarding process. And we would like to ensure that we try to move that along as quickly as we possibly can.
Great, thank you both. So Curtis, this next question is for you. Can we do a little bit more of a deep dive? And could you tell us a little bit more about the Peer Academy, how it was started, why it was started, anything else?
Sure. So the Peer Academy was started because in behavioral health, when we looked at the data, peer counselors actually had the highest vacancy rate of any title in the public hospital system. And we realized we needed to have a formalized pipeline for individuals who wanted to work in the hospital. There's many peer training programs out there, but none that were specific to the kind of difficult work of working in a hospital with the highest acuity patients. Locked inpatient units are where many of our peer counselors are working, or in substance use disorder programs. With really, if you come to the public hospital system, it is the highest level of care that someone needs, and it's a very different type of peer counselor we need. So we developed a training program really to prepare for that. This training program, individuals receive 2 state certifications. It's called peer specialist, that's the OMH, Office of Mental Health recognized certification, as well as the CERPA, Certified Recovery Peer Advocate, which is the OASIS recognized certification, which makes both of these roles Medicaid reimbursable. And then our training also has a lot on how to work in a hospital, There is a 6-week internship where they're doing rotations in the hospitals in different settings to see what is a good fit. And we also have, lots of community building activities. What's great about the Peer Academy and really the peer workforce is there's a very strong sense of community for individuals who are out as having, I have substance use challenges to be out. As someone who has substance use challenges or mental health challenges, it's important to have a community you can rely on so you're not so alone out there. Many people have these challenges but aren't out about it. So we also do a lot of kind of community building to really help build that community that can be a supportive network as they're in these high stress difficult jobs. So that's a little bit about the Academy. And then, if you're interested in learning more and getting an application, just send me an email.
Great. Now, Tonya, could you please describe some of the partnership programs that you currently have in place, and how do you think that some of these programs could be tailored or adjusted to start a program with system impacted individuals?
Sure. Thank you. So I did share earlier in the deck some of our pipeline partners that we currently have. The one that I would expound on is the one that we've done with regard to persons with disabilities. We partnered with an organization called the Consortium for Customized Employment. And we find that that program is a great model thus far. I guess the way that it's structured now is that we have the people at the consortium, they come to our institution, they have conversations with our departments with regards to particular roles. And ultimately, once a particular role is identified with that particular department, then a person is identified for that role. And as I indicated, it's a customized process. So what that means is that the job may not exist before they come. It's customized for that particular individual so that it's a fit both for the organization, for the department, and also that particular individual, just based on their particular skill set. So that's something that I think is a great model that we can definitely replicate once we identify a partner for justice impacted individuals. Again, it's a partnership that I find is very collaborative, and we communicate a lot. It's very engaging, and we find that it's been very helpful thus far with regards to the employees that we've employed. So far, we have about 4 or 5 individuals in that particular program that we've had within the last year. And we find that they are very dependable, that they really enjoy the work that they're doing. Some of the tasks that were taken away from some of their colleagues to give to these individuals, those colleagues are happy because now they don't have to do the mundane work. However, we find that the work that we do give to these particular individuals to be very engaging, and that they're happy thus far with what they're doing.
Great, thank you. So Curtis, I think your description was a specific role, but as a follow-on for you, Tonya, can you talk about what roles people do get hired into at the medical center? Sure.
So for the specific program that I'm discussing, which is for persons with disabilities, we have the roles vary because we do not put limitations on the role. So we have placements in human resources. So we have someone who's an HR assistant. We have someone who loves data and is a data analytics person. We also have someone who is a part of our union because they're in a tech role. So the roles vary, and there's no limitation on specifically where, when, or which particular department that they can assume.
Great.
As long as it's a fit.
Right. No, that makes sense. Depends on the candidate, right?
Right, exactly.
And then can you both, maybe you first, Curtis, talk about what career progression might look like?
Sure. So for peers, and I'll just say before is that the public hospital system is recruiting all the time for all roles, careers.nychhc.org for any role. And we are very committed to and have a huge need for all roles, and very open to individuals who are impacted by the system. So go there, and our HR is very good at supporting any individual interested in any role. So This was the selection process, right?
Yeah, that could be the next one. Yep.
Oh.
So it was career progress.
Oh, career progress, sorry.
progression.
Yeah, it's career progress for peer counselors. Like many in a large bureaucratic, we have a peer 1, peer 2, peer 3, which is great. It's a built-in career ladder, which is pretty unique. Many peer roles don't have this, but we do at health and hospitals. Peer 3 is a peer supervisor. So now we're really helping to build this career ladder as you can lead a team of peers as a peer 3. And many peer counselors choose to advance in behavioral health, go into social work and other domains, caseworker, case manager, discharge planner. There's tons of opportunity for growth at health and hospitals, especially in behavioral health. So really, there's lots of opportunity though beyond the peer role, as is in most medical roles, there is a need for degrees and further certification if people want to advance beyond the peer 1, peer 2, peer 3.
Thank you. At Columbia, there is development opportunities and career progression opportunities. Some of them are not specific. So for instance, if you're in the union, you may go from a particular level to another level in that same department or maybe in another department. But just being an employee at the medical center, which, you know, once we hire individuals, they're part of our employee group. They have the opportunity to choose to advance within 6 months if they would like to do that to any particular role that they may qualify for. So the only limitations that we have is the timing as far as whether or not someone can transition within 6 months or within a year, but there are no limits with regards to what that next step is.
Great. Thank you. Now, the next question is walking, you were so excited to talk about it, right? Please walk us through the selection process for candidates in these various programs.
Great. You want to start first?
Okay. Thank you. So the selection process for us, we have other programs. So for instance, if we're not talking about the disability specific program that I mentioned earlier, then the selection process is the same with regards to someone applying, having a point of contact in that particular department and going through the normal process. What we try to do with our pipeline partners that I shared earlier, and I do have my talent acquisition and sourcing manager here, Shaquana, who's a point of contact. We would have those individuals or that organization reach out to us specifically so that we are flagged. As you could imagine, we have 700 vacancies and thousands of applications. So if someone were to reach out to us and say, I'm from Strive, I saw this posting, there's this particular opportunity I would be interested in, then that person would be contacted directly, and then we would help connect them with that particular hiring manager. For the program that I mentioned earlier with regards to the persons with disabilities, again, as you can imagine, because of the nature of that particular program, we are more intimately involved. And when I say we, my office and Shaquana, who's here, because we want to ensure that it's really a great match for everyone involved, including the person with the disability, the career coach that is working with that particular individual, and the department and everyone else that are stakeholders in that hire.
Great, thank you. And so, yes, I was very excited for this question because I do feel like, especially for other healthcare employers in the room, there's a lot of things that we can do to really help the justice impacted population and just any population without a strong work history to have better selection processes that can recognize different types of talent. So I want to talk a little bit about how the Peer Academy works, as well as many other workforce programs I've done in the past for a variety of populations who don't have, maybe the same or consistent work histories. The first thing we do is we always have an application. We like to do a short essay in that. And, basically how the Peer Academy works is anyone who fills out the full thing is invited to a group interview. But we have that first one there. It really does help to self-select out some that can't complete that. And it's really, this whole process is a lot of self-selection out until the very end when we take our final decisions. So after that, we have a group interview, which I highly recommend for this population. And we'll invite maybe 25 people at a time, and maybe only 50 to 75% come, but that means we get to see 12 to 15 individuals at a group interview. And those that don't come, that's all right, and it's no time wasted. Instead of all these one-on-one interviews, having to schedule them and having people not show up is a great thing that we've done. And what we do at the group interview is we really create authentic tasks. So for the Peer Academy, we do we talk about how we ask everyone in small groups to share their lived experience. That's obviously a key role to a peer counselor, and see how people do. That's authentically what you'll do as a peer counselor. So we get to test them out on that. We also do some group activities. We do an art activity, which is really just a way to see how you work in groups and what does recovery mean to you. Another great way to see you'll be able to work in a team in a hospital, which is a huge part of it. And some can't really handle that group activity in a small group interview, and that's fine. But we see it right there. And then we do some role plays. We put real situations that happen in the hospital, and we ask them to go up in front of the group and role play that out, either as the patient or as the peer counselor. So what we've done is really just create those authentic tasks, and that's what we use to select on, because we can't always select on a resume or an education or something else, which really isn't super relevant to a peer counselor. We've really broken down what is and exactly what peer counselor will do, and we do that in an 1.5-hour group interview. And then from there, that's when we finally make our decision, and then we accept people from there. But I think that process with this population we're talking about is an authentic, great way to see who really is a fit when you can't always tell based on a resume or a degree.
Great. No, that's a very good point and very good insight. So what kinds of candidates have been the most successful once hired? So people in your existing partnership programs, or I know the Peer Academy has just started, but what have you seen as valuable attributes?
Sure. So for me, ultimately, when we're looking for someone, we're looking for that value add, but we're also looking for someone who is able to adhere to our mission, our vision, and also our values as an organization. And what that entails is someone who is accountable, someone with integrity, someone who has great customer service, because we are a hospital, after all, caring for patients and their families. Ultimately, though, at the end of the day, we value diversity that people bring to the organization, both from their identities, also as far as neurodiversity is concerned. So some of the things that we look for is to see, what is this person going to add to our organization that's going to be valuable for us? There may be a gap that is needed that we're trying to fill. So I don't want to just throw attributes out there to restrict us, to be quite frank with you, but someone who is definitely adhering to our values. I can tell you though, from the program that we've had thus far, we do find that a lot of the participants who are successful, that they have great attendance, they're very attentive to details, they're dependable when asked, and they're cordial. So those particular attributes, I say, would be great skills as well.
Great, thank you. I'll say our biggest, what we're really looking for in the Peer Academy, and really anything in behavioral health at Health and Hospitals, one is the able to consistently show up on time and every day, which is also why our selection process is multi-step. And I think another one, if you think about health and hospitals, huge employer, very bureaucratic city agency, is how to kind of function in bureaucracy. And really one of the biggest challenges, and people who are strong or can kind of solve problems on their own, know how to utilize their supervisors and know really not to go around their supervisors and respect that chain of command. In terms of, there's going to be some difficulties working with the individuals we serve in the public hospital system, but making sure that you really utilize your supervisor, not go around your supervisor in the best possible way is a difficult skill, but one we find is someone who can handle that situation, either solving it on your own or figuring out how to work well with your supervisor is really probably the biggest skill that's needed.
Right, super helpful. So to flip the tables a little bit, what could reentry agencies, the ones who are in the room or online, do better or more of to help you when recruiting talent, either now or as you envision partnerships in the future?
Thank you. I was like, this is a nice time to also talk to all of our friends here in the reentry organizations. There's a few things. One is the computer skills, right? Many of our individuals we support have been in jail or prison for a long time, don't have those basic skills. And if you can take care of that ahead of time or lobby to allow, some computers in the jails and prisons, we should all do that together. I think that would be great because we do have some amazing individuals who just can't handle the technology. We have one student in our class who's been in there for 31 years and just came out an amazing individual, but really, really struggling to deal with the electronic health record and the time and leave and even just email. So that's first and foremost. Two other things, helping individuals understand their benefits and really what does it mean in real economic terms. To take jobs. Peer counselors jobs are extremely important, but they don't pay a ton. It's about $38,000, but it's amazing city benefits, $0 health insurance, pension and union. But, there are some other benefits that they'll lose. There's possibly some housing vouchers you might lose. So if you ahead of time understanding what is the income threshold for an individual to whether it really makes sense to work or not is really important. If you could do that ahead of time, because some people think they want to work but don't want to give up a housing voucher or that. And then you could maybe volunteer. A lot of people do peer counseling for the the purpose and meaning it gives someone's life. So there's other options if the economics don't make sense, and sometimes they don't, and that's okay. But if you could help us out ahead of time, knowing kind of what is the threshold for it making sense or not, that would be great. And then the last part, any kind of understanding of what would possibly get in the way for background checks or state central registry, and if they might have those, maybe connecting them with Legal Aid Society earlier so we don't have these months-long delays. So they know it's going to come up, to have some idea of how they can start to get around that early will make it better for all of us. But those would be a few really helpful things.
Thank you. I think those are great points that Curtis shared. So I'll just add on. From my perspective, we are very decentralized at the medical center. All departments, they have the opportunity to hire the employees themselves. Of course, for us, most of us are probably under-resourced, especially during these times. So anything that you can do to make things easier for us, like Curtis gave the example of having the person contact legal aid. I had a situation where I had to reach out to someone who had an issue with their background come up. And that gentleman, he had everything in one folder. He was able to hand it over to me, and we were able to move forward with the offer. I've had situations where the person couldn't find this and they couldn't find that, and it just sort of drew out the process, which is not good for them or us. So anything that you can do to make our life easier and make the process move along faster, I think would really, really, really be helpful.
Great, all very good points. So I have one last question for our panelists, and then we'll open it out to the audience for questions. So for the other healthcare organizations in the room, who are interested in establishing programs, what advice would you give to them? So anything that you can think of, either in the starting stages or in the ongoing stages?
Yeah, I can start. So two key things for me. I would say definitely have a point of contact. So that person for us is Shaquana, who's here, because then that really cuts down on the communication and the delays when it comes to just trying to move things along. The other thing for me, just from a diversity, equity, and inclusion perspective, is ensure that your organization is really ready to partake in this type of process. So for instance, when we talked about the disability hiring program that we have, we trained everyone about disability awareness, ensuring that the people that they were going to be working with, that they're trained and what they can anticipate. The managers were trained. So you really have to assess whether or not your organization is ready, because ultimately you don't want to have a situation where you hire that person, they come to the job and they're othered, excluded, or ostracized because, you know, of their background or because of how they identify. So those are the two key things for me.
Yeah, I'll just say for our healthcare friends, you know, these roles of community health worker, which I consider in the peer family, peer counselors and others, I would say we have seen so much value in our peer counselors and community health workers working as, you know, really for helping a population that hasn't been able to connect with some of the traditional practitioners in our system. And so, you know, this is a great route for those who are hard to be served. Sometimes an individual just doesn't connect with a social worker. So having a peer counselor can work for very, you know, a large segment of the population, which is great to have these alternative methods. So peers and others don't replace anyone, but just give another way to connect. And sometimes a lived experience is what someone needs in order to connect. And same thing on the physical health side, a community health worker who has a shared cultural experience really sometimes can connect with someone in a way that maybe a traditional doctor or nurse can't. So adding these roles, which by nature will include reentry folks, justice impacted folks, and other folks who maybe have been overlooked or don't have all the same credentials, we have found have been really important for providing better services to the individuals we serve and connecting with those who just haven't been able to connect with some of the traditional roles in the healthcare system.
Great. Well, thank you both so much. I know I learned a tremendous amount. I'd like to open up the floor to questions. We have an enthusiastic hand right here. Go for it, Helen.
Hello, my name is Skip. I am the Executive Director of the New York City Justice Peer Initiative. As someone who is directly impacted, as someone who also trains those who are directly impacted, as someone who has also hired directly impacted folks, I understand what you say about the technology divide. What I am asking is that health and hospitals, and Curtis, you know I love you to death, but I'm sorry, I need to go here. Health and hospitals in Columbia are very huge organizations with endowments. I understand that you would like to receive people who are somewhat trained in technology. But can you partner with these smaller community-based organizations who can potentially supply you with individuals ready for employment, but partner with them and collaborate with them on kind of like something like an internship or on-the-job training program? I run a very small community-based organization. I'm always in the process of looking for funding. I would love to train my people not only in my Justice Peer curriculum, but in also technology, because it is a digital world we live in. You have to know how to use a computer, you have to know how to email and everything. But sometimes we can't get the funding to enter into something like that. And it would be great if these larger entities would partner with us and help us with funding and help us maybe with developing internships. Well, someone can come to you not really to be paid, but to learn how to work on kind of like on-the-job training, where it's already noted that, okay, so this person might not know how to use email. This is something that we can teach them during this internship.
Oh, thank you for sharing that. I shared earlier that we are still exploring at Columbia the appropriate partner for us. And you sharing that is something that we're definitely going to take into consideration when we're looking for the appropriate partner. And I think that's why we haven't partnered yet, because we really want it to be a good match with regards to the needs of the employee, ensure that they're successful. You know, one of the challenges that we've had with other partnerships that we've embarked on is, you know, they send people to us and then we don't hear from them until they need to send the other person. And I think that's something that definitely needs to change, and why in the program that we have that's been really, really successful, there is a career coach available. Anything that we need that's outwardly communicated, and we work together to ensure that we rectify that.
Yeah, thanks, Skip. Yeah, I mean, I think we can definitely do some things on the job, but you know, I think it's a matter of what point does it make most sense. You know, it's hard if we're paying someone to say, let's pull them out for long-term training once they're in a paid position. So we are doing it in our peer academy, some of that work, but it would be best if it happened a little bit earlier, just to make sure people are ready. I mean, I think we all have a stake in doing it. We do have continuing ongoing training and education in health and hospitals, which of course people can take part in, but it would be good if as much as possible, as much happens beforehand.
Right, good point. Gyasi?
Thank you, Tonya and Curtis. It's more of a comment. I do appreciate your acknowledging the fact that individuals may have challenges with technology. One of the things, not having gone through the application process, but we've experienced at Osborne, is that the onboarding and application process is not mobile friendly. So really thinking about how you can make sure that when you're developing application processes and onboarding processes, that it is something that's mobile friendly, because as you know, many of our men and women don't have desktop computers. They're operating from a mobile device. That would be one thing that I would ask that companies think about. I'm speaking from a point of ignorance, not having gone through your application and onboarding process.
Great. No, I think,
Thank you.
did you want to respond? Or?
No, I would just say thank you for the comments. For us, we're trying to remove as many barriers as we possibly can from the application and the onboarding process. So thank you for that.
Great. Thank you. We have a question in the back of the room.
Hi, thank you both, Jonathan Boniuto from Honest Jobs, Tonya Richards. Thank you so much for this. I really just appreciated your entire presentation, but especially on the supportive things that you're doing during the selection process and helping remove the barriers. What I just wanted to mention briefly, and try to be careful with my time, because I know other people want to talk, so I'll just get quick, is the formerly incarcerated population isn't a monolith. By many individuals are are recently released or may have not had those skills. But there are thousands, millions of individuals who have maybe had a long career in something, but then once they lose their job, they have to start all over again, and the collateral consequences continue to hit them. My question is, the healthcare system has some of the best jobs available, and the most jobs available, especially during the pandemic. The issue is there's a lot of barriers preventing these individuals from achieving these career track jobs. Many things outside of the hospital's control due to regulations. We've seen some peers in the financial services industry, for example, pushing those regulations and actually asking them to be changed, because ultimately those regulatory authorities listen to them more than anyone else. Is there a movement at all? I know this might be above some of your pay grades, but is there something around this where the hospital system is considering removing, so people could get into the, I know personally some people who were registered nurses who can't go back to that profession, but they would love to do it if they could. Is that something that I know is happening at all in the New York State level, or that there's an interest in supporting?
I think that's a great question, right? I think, that's a great model and something we could consider. I think, bringing hospital systems together to address those issues, would potentially be a great next step. So thanks for the suggestion.
And I would say that some of the laws are changing. Most of you may know that the process as far as onboarding now, it's a bifurcated process, which means we need to make an offer before we do the background check. And that's something that's also causing a delay with regards to the onboarding process, but it's allowing more decisions to be made with regards to making offers that doesn't have anything to do with that particular background. And that's as far as I know. Everything else, I don't.
I'll try to talk to you later. My company helps a
And
lot.
I just want to give a quick shout out to DOHMH and Caesar, and I would say, having worked at both institutions, that really the policy side, I think, is really well handled by DOHMH, where the public hospital system, we would probably take our talking points from DOHMH, which might be more policy, and we're more a little bit patient focused. This is our kind of bottom line stuff that we work on every day.
Great, thank you. I think we'll take one more question, and then I want to make sure that we have time for our second panel. Tony, did you have a question or comment?
Question. This is just for the healthcare sector. I'd like to thank both of you. What we've seen on the reentry side, speak a little prematurely in regards to the other agencies are present. We've seen a rise in demand for our population justice involved individuals as the demand for workforce has increased as we navigate through the new norms. Does the same apply? Does the same apply for the healthcare sector as we see a lot of the stipulations and some of the red tape that has made it more of a challenging process? We've seen a reduction in that. Is it applicable in the healthcare sector as well?
I mean, from my point of view, the demand, as you said, has increased. I don't think we've seen a huge change in the regulations in terms of, I think there's a real hesitancy to say, that individuals in hospitals are very vulnerable, right? We have, so there has been, I think, a hesitancy to lax any of those staff. I mean, we'll say the one area that has changed a lot is this visiting nurses, and there has been a lot of movement towards temp as a replacement because there's such a need, but it hasn't changed the regulation. It's more changing the sourcing of the workforce.
Yeah, I would agree.
Thank you for all those wonderful questions. Thank you, Tonya and Curtis.
All right, great. Let's get started. This is panel 2. We are going to be focusing on training employees for the healthcare sector. I'm Cesar Lopez. I'm a senior advisor for policy at the New York City Department of Health. I also wanted to thank my colleague, Nathaniel Ornis. And just to give ourselves a better sense of who's here, if you consider yourself more of a healthcare employer, can you raise your hand if you're in the room, if you're able? And then also, can you react if there's anyone on the Zoom? Healthcare employers? Okay, great. And then if you are more focused on training employees or reentry, can you raise your hand if you're able and react? Okay, great. All right, about 3 participants raised their hands. All right. So we have Gyasi Headen, Director of Workforce Development at the Osborne Association, here in the room with us. And we have Tara Gilbert, Director of Business Development at Strive. Tara, can you maybe, let's hear from you to see if everything's working on the tech end.
Oh, sure, Caesar, can you hear me?
Yep, you sound great.
Oh, fantastic, okay.
All right, so just to get started, Tara, let's start with you. Can you please introduce yourself a little bit more and tell us a little bit about your organization?
Of course, thank you. My name is Tara Gilbert. I am the Director of Business Development here at Strive. Strive is a well-established training initiative that's been around since 1984 in East Harlem, but we serve all 5 boroughs. We currently have several cohorts and several programs. We have a construction cohort, we have an IT support specialist cohort, and of course, our health administration cohort. We also have several programs that help us serve the different populations in our area, whether it's our Fresh Start program for those who were recently released. We also have our Future Leaders program for 18 to 24 justice involved, and then our career pathway 18 and up to help everyone in the community. We currently have a Strive here in New York City. We opened up a Strive Atlanta in the height of the pandemic in 2020, and we are in the process of opening 2 more locations in the United States before the end of the year, in addition to about 10 affiliates that we have throughout the United States currently using the Strive model.
Great, and then to you, Gyasi. Over to you, Gyasi. Can you, you want to take the?
Thank you, Cesar. Good afternoon, everyone. My name is Gyasi Headen. I'm the Director of Workforce Development at the Osborne Association. We're an organization that started in 1933, primarily as an advocacy organization. Currently, we're serving men, women in the prison and jail system throughout New York State. We have staff that are working in upstate prisons, New York City jails, and in the community providing services to men and women. Our primary function is to make sure that individuals that are impacted by the criminal legal system have an opportunity to repair from harm, heal themselves, restore their lives, and thrive. Our education component, our employment component really deals with helping men and women find opportunities in the construction industry, retail, and janitorial/maintenance, and healthcare industry is an industry that we're really excited about entering because it provides an opportunity for our men and women to do something different than what they're on now. Thank you.
Thanks. Second question is, can you talk about how your organizations first considered opportunities in the healthcare sector for your clients, and what was the impetus for that?
Tara?
So we started immediately with supportive services role for our clientele. We believe that this is a great way for them to create an entry point into getting into health and office administration. And then it's also being able to carve out a career pathway for them in the long term as well. So we just know that if we're training them from an entry level standpoint, they have the opportunity to grow and flourish in a career.
For Osborne, it's really our start into the healthcare industry. Primarily, we've worked on putting folks in the low barrier to entry opportunities, and we realized that we're selling our participants short, right? There are many individuals that are interested in careers and things that we haven't provided opportunities before. So this is for us an opportunity to really propel and move away from the traditional low barrier to entry opportunities, right? Construction, retail, janitorial maintenance, and understand those are great jobs, but the healthcare industry is also an opportunity for folks to really propel themselves and move from low wage or middle wage to high income opportunities. And there's tremendous career opportunities in the healthcare industry. So for us, it's just become something for us to move forward for our individuals.
Thanks. And for with other reentry organizations in mind, can you talk about how you were able to set up your programs and how you created relationships with healthcare hiring organizations specifically, or general employers? Can you talk about the process, including challenges and surprises?
Okay. For us, we're just starting in the healthcare industry. We have a relationship with Community Health Network up in the Bronx. And it started as really them approaching us saying, we're interested in working with the criminal legal system involved individuals. And it just propelled shortly after Ivy reached out to us and said, let's have a conversation with the healthcare industry. They're really interested in opening up the population, opening up their opportunities to your population. So for us, it's really been a learning experience with CHN. It's really about understanding how to leverage relationships and partnerships. they don't know our participants, but they know us as an organization and know the work that we do. And so we have taken that opportunity to really put individuals in employment situations so that they can excel. You know, just with any other employment situation, not just the healthcare industry. It's really about networking and about relationships. They know us. They know our organization has been around since 1933. They know the work that we do to both help the individual and help their families. So it's really been a natural progression for us. And once again, healthcare industry is a huge industry that's been untapped. We understand that our men and women have had their own misperceptions about working in the healthcare industry. I have this particular crime, I can't do this job. And while that may be true, there are other pathways for them to enter. And we want to make sure that we have the relationships to make sure that that happens.
For myself and for us here at Strive, we wanted to set up the program based around the needs of the employers. So we really make it an earnest effort to listen to our employers. We created these great relationships with a lot of folks in the room right there. And we have found that listening to our employers, getting that feedback helps us to create our training programs, helps us to improve our training programs. Sometimes we need to supplement it with different certifications, and sometimes we need to alter our training. So it's very, very helpful, the relationships that we've built on, because that's where we get the source of what we need to do for our clients. And that's where we get a lot of the feedback for the trainings that we need to conduct and how to expand our trainings and what we're looking to do in the future.
Great. Could you describe any preparations on the part of the clients that you've had to undertake?
For us at Osborne, it's not a formal training program. We're not training individuals for the positions at the organization. What we're training them for is to work, right? Be able to show up on time, be dependable, be able to accept the critical feedback. And hopefully we get to a point where we have some of the relationships that Tara talked about so that we can establish a true formal pipeline for individuals looking for opportunities in the healthcare industry. Ultimately, our goal as an organization that serves thousands of people a year is to become a pipeline, a true pipeline, to be able to be responsive to the needs of the potential employer.
And our training program is actually a very well thought out program for our health and office administration that's at least 10 weeks. It incorporates our job preparedness, job readiness, and then the hard skills or occupational skills part of the training as well, which is where the students, you know, the rubber meets the road, where they're actually learning about Outlook and Microsoft Office Suite. They are getting their EHR, electronic health records, and they're practicing on their typing. Within that parameter, we also try to incorporate an internship so that students are actually getting that knowledge while they're learning. So it gives them not only more experience, but it helps to build their resume so that makes them much more marketable when they graduate.
Great. And Tara, again, back to you, since your program is a little bit more developed. Though Gyasi, feel free to also chime in. Can you share some success stories about some of the people that your organizations have served and how things have gone well?
Sure, we've had many, Caesar, honestly, and I'm just so proud of that. I'm proud of how my team connects our students to the right employment, making the right job matches. We've had students who were just recently released and have gotten into great healthcare positions with some of the larger health hospital systems in the area. They've started recently. We've had a graduate who started out in working in like the loading docks and getting everything ready for all the different hospitals on the loading docks. And with that position, that particular student is now has been promoted to another position and is looking to tap into the tuition reimbursement so that he can learn to become a sonogram tech. So we have so many success stories. I have other students who have started out in maintenance and who've worked maintenance overnight, went to school during the day, and has come out and has done sterilization tech. So we have a lot of students who come in, they take heed of our program, they learn, and they go out and they start applying. we are always focused on the career pathway as opposed to a job. So the students leave here with that mindset and are constantly looking for the next way to catapult to the next earning potential, to the next level.
For Osborne, the success has not been relegated to participants. It's really about our relationship with CHN and our children. Recently, an RFP came out where there were special projects RFP came out, and we decided to collectively go for it together. In the current relationship, a lot of the work is being done in kind, so staff's time is being diverted from their other functions. And so we actually had a meeting yesterday and decided, you know what, for us to move forward or for us to better serve the population, how about we leverage our relationships, leverage our information that we have now and put it together and really respond to this RFP so that we can get the resources to do this effectively. Because I think you've heard from Curtis and Tonya that this requires man and woman power, right? And to have folks divert themselves from what they're currently doing is effective, but it hasn't been as effective as it can be. And so we're looking forward to really responding to the RFP and hopefully getting a positive response so that we can really grow the program.
Great. To both of you, how would you like to see your programs evolve into the future? Would you like to expand, grow our programs, and if so, can you describe what the ideal would be?
Tara?
So we're constantly looking to expand and evolve. We're always listening to the labor market, listening to our partners, listening to what the trends are. We want to make sure that Strive is relevant and continues to engage our community at a level that helps them to get to that career. Personally, I am chasing after 2 new trainings that I understand are really hot right now in the medical field, which is a sterilization tech and also a pharmacy tech. So these are just programs we're looking to evolve and create a training around, and hopefully can do so in the very near future.
Thank you. For Osborne, one of the things I've always looked at is Tara's model of working with the healthcare industry. And what we want to do is start something very similar, but also use our leverage our relationships with individuals in this room to create a more effective program. I think that there's an opportunity to learn from what Strive has been doing and pay attention to the market and just create a more vibrant program. We see, once again, tens of thousands of people a year, thousands of people come through our employment focused programs, and want to just make sure that we build something that is effective to the needs of the employer, but also our participants, because I always think about Field of Dreams where they say, build it and they will come. It's important for us to build something that's relevant and credible for our participants, because we can build a model that the hospital industry wants, but it may not be something that our participants want. So we want to make sure that we're paying attention to the feedback and incorporating that in the trainings that we provide.
Great. I have about 2 more questions for the panel, but if you're on Zoom, please type in a question if you'd like it to be asked, and we'll be able to read it here in the room. And also, if you're here in the audience, start thinking about what you might want to ask. So back to the panel, what advice do you have for any organizations in the audience today who's interested in setting up a program with a healthcare organization?
Tara?
I'm sorry. See, it kind of froze for a second. I'm so sorry.
I can ask it again.
Yeah, I didn't hear.
What advice do you have for any organizations in the audience today who's interested in setting up a program with a healthcare organization?
I would have to say, make sure that you are understanding your participants and the jobs that they're looking to do, and then creating a training around it so that the students feel that they have the confidence to get into the job market once they graduate. I think that would be my biggest takeaway.
For Osborne, listen to your participants, listen to your community partners, and really develop that communication. You want to have a space where folks can have real, open, honest communications, because I think I've been involved with relationship building endeavors where folks were in the room saying one thing and would go back to their company or organization and say something very different. So for me, it's really about having communication with each other and really being able to really have positive and negative feedback and figuring out ways to improve things that are going not so well and enhance the things that are going well. So for me, it's really about leveraging, having strong positive relationships or strong communication. Excuse me.
Great. And last question from me, to borrow something that Ivy asked and to flip it. Because you guys have the mic now, what do you think healthcare employers could do better or more of to assist reentry organizations and the populations that you serve?
I'll go first this time. No problem, Tara. Use their microphone. They have a huge platform that reaches many of New York City residents. I think one of the things that you don't hear enough about are employers that are hiring from this population. I know that oftentimes they do it because we know that there are folks that are employed with you, but use that microphone to say, we are open, we're willing, we are interested, and we want and need you. Really, for me, that's the biggest thing I would love for hospitals to talk about and utilize their platform to really just reach out to the community and say that, we want you and by way of their own platform, but also engaging with community-based partners and letting them know that we want you, and then coming into those organizations and speaking to their participants to let them know about the tremendous amount of opportunities, because I know maybe of 100 positions, but there may be 1,000 positions in the hospital. And so you speaking firsthand and possibly even having one of your, justice-involved individuals coming to talk and say, I was where you were at, I was in your circumstances, and here I am now doing something different.
So thanks, Gyasi, for taking my thoughts. I was also going to say that it's so important for the hospitals to let our candidates know that there are opportunities for them. A lot of those who have criminal blemishes on their record are so uncertain and kind of scared of applying because they don't want to be let down or feel that they wouldn't be even considered when that's not the case. Fortunately, I always have someone from either 1199 or any of the other hospitals come in to talk to our graduates, and to see their faces, to realize that this is actually an attainable goal is something that is great, but it's because I invite them in so that our students are aware. But I think the healthcare partners need to understand that they need to be a louder voice so that everyone knows that they are eligible and able to apply to these positions, because it's a great start. It's a great career.
Thank you. Let me see, have any questions come in on the Zoom?
We have a question from Christina who asks, how can we begin educating folks on what charges really mean? I ask because oftentimes people reading the CBC determinations have very little understanding of the legal lingo and what convictions or arrests really mean. Sometimes charges sound a lot bigger than what they are.
I'll take a stab at that one.
Okay.
One of the things that we've done in our organization is we partnered with Legal Action Center, we partnered with Community Service Society, we partnered with Brooklyn Defenders to help bring folks in, Human Rights Commission, really just to have folks understand what a rap sheet is and understand that, and I think Tonya spoke about it earlier today, where there's inaccuracies and making sure that they get those inaccuracies cleaned up off their records. So it's really important to get organizations that specialize in cleaning up rap sheets into your organization to really help you decipher and understand what's going on. Because even as a system-involved person, when I first looked at my rap sheet, I didn't know what some of the things meant, and there were errors on it. And so it's really important for us to get experts into the room to talk to your individuals.
And just to, were you able to hear the question enough? Or do you need me to re-ask it?
No, I heard it. We actually
Okay.
do the same thing that Gyasi just said. We actually do the same thing. We have people come in to help our students decipher what's on their rap sheets. We have other organizations that partner with us to help our students so that they are armed and prepared when it's ready for job time.
Okay, there's one more question that we received through the Zoom. It's, how do we teach hiring managers to unhear justice impacted information that is disclosed prior to an offer? Some justice impacted individuals overshare, trying to overcompensate for their involvement.
we try so hard to teach our students how to interview and how to not feel like they have to oversell themselves. So it's something that we continually battle. I know it's hard for somebody to unhear that once it's been said to them, but we only ask that you give our students a chance or take a chance. Essentially, with or without a rap sheet, you're taking a chance on everybody that you interview that day. So if you hear something that you can't unhear, please understand that you need to see that student based on their merits, based on their credentials, based on certifications, based on the person that they are in front of you, as opposed to what you heard behind them.
I agree with Tara. One of the things that you said, Tara, is you can't unhear it, but you have that person in front of you, and obviously they're in front of you for a reason, right? You've seen their resume. There's something about them that stood out to you. So I would just ask that you consider that person sitting before you and understand that the past is the past. And hopefully, during your conversation with them, you hear who they are as an individual today and take that more into consideration versus the past decisions that he or she has made.
Any questions from people here in the room? Yes.
Yeah, my name is Aidan McDonald. I run a program called Justice Through Code here at Columbia University. We actually provide technical skills and professional skills training to people returning home from prison, both software engineering and recently expanded to data analytics. Gyasi, you spoke about something that we often encounter with our participants, which is the idea that there's a career in tech is something that really has to be built and explored, right? Because so many of our participants do not see that for themselves. So I'm wondering, and Tara, you had also said that kind of you work on making sure that participants like that you're responding to where they see themselves in their career. So I'm wondering how you build that for students or participants in your programs as they're starting, right? And this speaks also to the employers in the room, kind of how there could be a better collaboration possibly there in terms of creating the knowledge that these careers are there and the pathways, because I think until that's there, it's really hard to push for the educational part, right? If you don't believe there's something at the end of the pathway, how are you going to push through it?
It's something I think America does really well with young adults, is open them to opportunities and help them see what the possibilities are. It's not something that we do necessarily well for older adults. And one of the exercises we have in our job readiness program is really around focusing on career exploration and getting to understand where people want to go. And through that conversation, it's really to just talk to them about what's happening now that we're coming out of the pandemic. And as a leader in the organization, it's really looking at bringing individuals into the room to talk to them about other opportunities. And once again, it's something we do really well with young adults. We go to college field trips and we take them to museums and we take them to a whole lot of other experiential places. We don't do it with our adult population. So for me, the goal is really just to use that information that we gain during our workshop and to bring individuals that have that experience, have the understanding of the industry that folks want to participate into the room, because adults, you go through experiences and you learn through that experience. And that's my ultimate goal for folks. And I think that's the best way to help people understand what's out there, is to have folks that are out there come into the room, because I know what I know and I don't know what I don't know.
Caesar, you're going to have to rephrase the question because I didn't hear it.
Okay. I'll do my best to redo that one. Feel free to jump back in, but is it like, how do you build the collaboration with the entities even before you get to all the education and the other aspects that are needed? Here we go. He's going to have a microphone.
Yeah, I would say, how do you really build the idea within your participants that this is a career pathway, that there's an option for, right? I think like healthcare seems like a very kind of intimidating space, as does tech, right? And it's a space that a lot of people who've been impacted by incarceration don't see themselves in. So how do you kind of confront that as an organization?
So we actually have an amazing training team that works to kind of change the mindset, making students understand that the best positive outcome is not just to land a job, a 9 to 5 where you have no growth, where you have no challenge. We create the idea that a career pathway, that a career path is something that you're constantly working toward. It's a goal that you're continually running to. And I think that gives people the motivation to want to graduate and then see how far they could go. When we built around our IT support specialists, we built it with this to say, listen, once you get this CompTIA A+ certification, this is the next step. Maybe you get into cybersecurity, maybe you get into network admin, but we want to make sure that they see long-term that there is a career pathway. And I think once they visualize it, they have the motivation and the excitement to want to attain it for themselves and for their families. That's what most of our students who come here and do our panel interview tell us. They want to do more for themselves. They want to do more for their families and their children. And I think a career pathway is somewhat the answer for that.
Great, and I understand we have a comment from someone on Zoom. We're going to turn your microphone on in just a second.
Can you hear me?
Yes,
Monique.
please go.
Hi, Tara. So I really wanted to make a comment towards the question of how do we help hiring managers unhear, right, certain things, or when we have candidates that are oversharing. I think to that point, for hiring managers, it's not necessarily, hearing that and that's it. But I think that the training or that there needs to be some training or some advice given on once you have, shared some of your history that, maybe in nervousness, to really just speak through that and to really share a little bit more about maybe the experience that you've had there and how you are moving forward. I think that for the most part, most companies are doing behavioral interviews. And so they want to know like how past behaviors are going to affect future actions. And just speaking to, your participants about how to just talk through that, right? And how to share what the goal is, right? What the experience was and what the goal is would be helpful for them not to just leave it there, but to just, explain a little bit more, share a little bit more about what they would like to see happen in their future, especially when it comes to careers.
Thank you. Anyone else here in the room? We do want to allow some time for some closing remarks and some networking, but if there's anything else in the room? And anyone else on Zoom? Okay, great. Thank you. Thank you, Tara and Gyasi for joining us in this panel.
Thank you so much.
So we'll just do some brief remarks. Ivy, are you going to join up here? I think I really appreciated the history that you touched on, Damon. I think that to think about the evolution of this initiative over the past few years, I think it's really remarkable. And I think that the partnership that we hope that has really started over these past few months and weeks and here today, I think that's gonna be what can carry us forward, and learning from each other about things that work. So I'm really excited about where we're gonna go.
Great, thank you, Caesar. I also wanted to say my thank yous to so many of you who have been in the room since the very beginning, for hanging out with us, 4 sessions before COVID and then post-COVID as well. You know who you are. I also did want to thank Caesar for his partnership. It's not often that the New York City Department of Health and Mental Hygiene connects with the chamber. Well, with me anyway. It's such an unusual partnership partnership. People are always, you know, when I explain what I do, they say, wait, how is Columbia Business School working on employment for people who are formerly incarcerated with the Department of Health? And it's a long explanation, but we get there eventually. So I wanted to thank you for your partnership and your efforts over these years as well. I just wanted to close maybe piggybacking a little bit of what Aiden was talking about. So when I am not doing this work, I actually do career advising for MBA students. And your question, Aiden, about like, how do you make something a possibility for someone, right? It goes beyond people with criminal records, right? I see it with students every day who want to pivot to a new career or, you know, and don't have the experience, don't have the self-confidence, just aren't able to see themselves in the role. And it's really giving that person the encouragement and the models and the support to have that spark of hope, really, right? And so as we leave this room, I would love for all of us, either on the employment or reentry side or the healthcare side, to really not lose sight of the fact that what we're really doing is sparking hope for people. And it's a win for the hospitals and it's a win for those individuals and their families. But you know, we're here and we're creating hope, and it will. You know, I'm going to mix all my terrible metaphors, like vertical out to scale into the universe. And so hopefully, you know, we'll take it forward from here. So thank you all again for being here, and, you know, let's go network.
Thank you for IBC who've been putting these things together. It's been a fantastic partnership that they alluded to. It's a very rare one to have, but it's also rare that it's also successful and really working well. And so thank you.